Good afternoon, everybody. I was having a conversation with a friend right before this, and I was telling him how much I learned from both of your books. And I encouraged him to come over, and he said something that actually I think is really enlightening. He said, "I am so over COVID, I don't want to have to think about it ever again." And I called him out, and I said, that is exactly why you need to read both of these books. Because I, too, am so over COVID. I'll be honest with you, we had 2 young kids, and I'm an extrovert, and, you know, kids are great, but real conversations with real people are wonderful, too. And it was really hard for me personally. And so I didn't want to have to think about it again, and frankly, once we were all back, I didn't. I didn't take the time to actually stop and think. And these books and moderating the session is the reason why I've had to stop and think about what COVID did and what we didn't do. And so I'm really grateful to have this conversation. So thank you to both of you. Can I get a round of applause for 2 wonderful authors that applied their talents to this? And so I'm going to assume that most in the audience have not read both of the books. If you have, you'll have an edge in this conversation. And try and guide the audience through what I learned and delve really deeply into why these books are so important. So I'll begin with sort of a framing question. Most of you probably know Bethany and John through their other works. And so Bethany, Smartest Guy in the Room on Enron was in 2003. All the Devils Are Here on the Great Recession was 2010. John's Rising Tide, of course, on the Great Mississippi Flood of 27, came out in 1997. And The Great Influenza on the Spanish Flu of 1918 to 1920 was in 2004. So these are books that you have been immersed in and your careers have been all about, leading up to then working on this work. So for both of you, before we delve into your new books, what did those earlier projects mean in terms of what you were bringing to bear, your perspective, and how you approached it? John, you go first, please.
Okay. Well, first, you know, I am a co-author of this book, and it actually evolved from an effort to create a nonpartisan commission. Several the foundations, Rockefeller and others, including one of the Koch foundations, incidentally, approached Phil Zelikow, who had been the executive director of the 9/11 Commission. And it seemed pretty clear the government was not going to form a commission like the 9/11 Commission. And they asked Phil to put together a team of experts to do what the government was not going to do. And there were 34 people, all of them subject matter experts. I probably knew less than anybody else on there, but I could add some historical perspective because I was both involved after my influenza book came out. I was involved in the conceptualizing of of a response to a pandemic. So, you know, it was sort of an obligation, really, to do that. It's not the way I would normally write a book, and well, I'll cut that off and let Bethany. So that was the product of 34 people who knew what they were talking about going in. In addition, we interviewed over 300 people who were directly involved or had other opinions. We went way beyond the fact that it was just what we thought. And as I say, many of the 34 people, including myself, we were directly involved in the response itself, various states.
Bethany.
So I think I'm unfortunately something of an ambulance chaser as a journalist. When something big and bad goes wrong, particularly in the economic sphere, there I am. So Enron, then the financial crisis, and then the pandemic. And the original framing of this book, which I co-authored with a guy named Joe Nocera, who was my editor when I worked at Fortune and edited The Smartest Guys in the Room, and then we co-authored All the Devils Are Here together, was about the economic effects of COVID. And I think we were also just both struck from the beginning that the partisan divides that shaped up around COVID, because if you said you cared about the economy, then you were very quickly accused of not caring about people's lives. And I never understood that distinction as somebody who has written about business for 30 years, because the economy is people's lives. If people can't make a living, provide for their children, believe that their families have a better future, that's life. So the book project morphed as we went on into being more than just a look at the economic effects of COVID and the economic failings of it, and I hope into a coherent look at the broader failings of leadership.
And so, John, I want to ask the question that you sort of posed with your question, or your answer, which is that the U.S. government chose not to create a commission. And reading from page 24, there was actually a bipartisan bill, folks, to establish a commission that passed out of committee in the Senate, but never made it to the floor, and it died with the end of the 117th Congress. John, what does that say about America that we never did a commission on this?
Well, you know, we were in touch with, again, Phil Zellico is, you know, very plugged in to the national security. So I actually had worked with Ron Klain, the White House Chief of Staff, and I would constantly email him, try to get him to agree to this. The initial response was, we're too busy. When things calm down, then we'll seriously consider it. Of course, at that time, it looked like only the Trump administration would be embarrassed. But subsequently, the Biden administration didn't perform all that well, and we just never got the support. That bill that you just mentioned was pretty much vetoed by, you know, not formally vetoed, but, you know, it was indicated, the administration indicated they didn't want it to happen. The reality is, I think only a non-governmental commission, such as what we tried to create, would have worked, because I just can't imagine the Speaker of the House and the you know, the majority leader of the Senate. I mean, some of the people who would have been appointed to that commission by the politicians would not have been useful in searching for the truth. In the end, we didn't go forward as a formal commission because we would have needed the Biden administration's cooperation. We didn't have subpoena power, unlike the 9/11 Commission, so they would have had to instruct everybody in their administration to cooperate. We did not get to cooperation. I don't think our recommendations would have been much different. As I say, we talked to 300 people, many of them who were in both administrations, both Trump and Biden. But we didn't end up with the imprimatur that we could have had and the impact that we could have had, I think, had we been a formal commission.
But yet you have so many facts in both of your books, and these are very deeply researched books that you can just mine through, and you learn so much. You think you experience this and you understand what happened, and then you read these books and you realize how much more there was actually going on. So, John, Lessons from the COVID War states, quote, "No country's performance is more disappointing than that of the United States." Let me share just a few statistics with the audience that sort of ground that from both of your books. There was $5 trillion in fiscal policy responses between Q1 of 2020 and Q3 of 2021, $5 trillion. More than half of all the PPP money went to just 5% of recipients. And a quarter of the money went to just 1% of the companies. A hedge fund manager admitted, quote, "Never have so many oligarchs been bailed out by the U.S. taxpayer." The cost of lost lives and our lost GDP made it what was called the $16 trillion virus. That's trying to tabulate all the lost lives and the lost GDP. And I thought this was especially telling. If you compare US and Europe, and this is all of Europe, including Eastern Europe, we are better off financially, but it's about the same population number, 330 million in the US, 268 million in Europe. So if you're making that comparison. Yet the excess morbidity was 40% higher here. As we let that sink in, I'm going to turn to both of you, but Bethany, starting with you. Why was America's failure so expensive?
So one of the central arguments in our book is that a lot of the problems were baked into the system before COVID even hit. And I think part of that is our very dysfunctional healthcare system, which, as the pandemic reveals, rewards, pays for service, but doesn't pay to keep people healthy. And all you need to do to look at that is to see that we spend twice as much on healthcare as a percentage of GDP of any other developed nation, and yet our outcomes in COVID were so much worse because our population, a lot of people don't have access to healthcare. I think a relentless quest for profits has made people focus on profits at the expense of the bottom line. So we saw that when it came to the search for PPE at the early stages of the pandemic, that it was supply chains that have been made really, really, really fragile in an endless quest to maximize efficiency, end up not being very resilient. And then I think the wonkiest component of it is that our financial system is quite a fragile place, and a lot of the bailout that the Federal Reserve had to do in the spring of 2020 was really to address longstanding problems in the financial system rather than necessarily things that were explicitly caused by COVID. And that had the effect of making the rich richer because Federal Reserve policy tends to benefit asset holders, and asset holders asset holders are the very rich.
John?
Okay. Well, one thing that we definitely agree on, I do have some differences with Joe and Bethany's position and other things, but it was a disaster waiting to happen. That we in our book described Trump as a comorbidity. A lot of things went wrong that had nothing to do with him. The healthcare system, the information system, the idea that people are faxing information, it's almost off the scale backward. Until you got the vaccine, the biggest medical advance came from the United Kingdom when they figured out dexamethasone had a very significant impact on mortality, a very cheap drug, and they just did that from correlating treatments with results because they had the data. We have no system like that. We didn't know where the virus was, testing aside. Everything was just so backward. But I'll leave it at that and try to save some time.
So Bethany, one of the points that you made that I think is really important for this audience to learn more from is in the early days of COVID, and you mentioned it, the hospital systems were forming a consortium to pool $300 million so that they could compete with hedge funds for PPE.
Yeah, the scramble for PPE was just a crazy, crazy saga because hospitals around the country couldn't get their hands on anything that they needed, and they found themselves being outbid by all sorts of unscrupulous players who would attempt to get their hands on the PPE and then mark it up and turn around and sell it to people at a huge profit. And there are all these stories from inside hospitals of people finally getting PPE that they needed, only to open the boxes and find that the masks were ripped and the gloves didn't work. It was just complete and total chaos, and I think I can echo John's point here about just a lack of a system. And there are strengths about our federalist system that leaves everything up to the states with very little central planning, and there are weaknesses, and this was a huge weakness. And there are, I think, some strengths of our capitalist system, but there are also problems that happen on a broader scale than just this when capitalism enters into a sphere where maybe it doesn't belong, and where people can't put aside their quest for profits in order to do what's right.
Yeah, that is an area that I think you can lay 100% on the Trump administration. The failure of the federal government to act as a purchaser and disperser of goods. It's incredibly stupid to have states, hospitals, and every other entity bidding against each other to get scarce resources. It's just crazy. And one of the worst things that happened during the pandemic, certainly in the early stages.
And John, in the early days, and this is an important question for us as New Orleanians, why in the hell was FEMA in charge of dispersing the money? Because, as you write, the quote, rolling nationwide crisis that spanned years, which became this global pandemic, especially early on, was handled by FEMA. And we had a playbook, but as you said, quote, the playbook didn't actually diagram any plays. It was a diagnostic manual. The playbook was a blank page.
Yeah, that's logic. I mean, FEMA is designed to handle a local problem, one at a time. At worst, in sequence, not simultaneously. That's, the federal government's bureaucratic. There DHS, Department of Homeland Security, HHS. They never ironed out who was in charge, never. It should have been the White House, and only the White House can really knock heads together and get departments to work together. HHS does have an assistant secretary for preparedness. I forgot the exact ASPR, preparedness and response, assistant secretary for preparedness and response. He had nominal authority. He was a very good guy, but the White House hated him. The question was always, is it a system that's failing, or is it people that are failing? In this case, we had both. I do believe, however, that good leadership can overcome bad systems. I also think no matter how good the system is, without good leadership, that will fail. I mean, here again, many states actually did a fairly decent job. And one of the things that we discovered that was somewhat surprising was that it really didn't matter that much whether you were red or blue state. For all the headlines and difference and the partisan differences, by and large, they ended up acting about the same way, about the same time. There were, of course, exceptions to that. But to leave this to the states without real guidance and leadership, is the biggest failing of any president that I know of, frankly, and probably since the Civil War.
Bethany, your thoughts?
So I echo that. I think that reducing this, and I don't think you're doing that, but reducing this to the question of a president is not. I don't think it's just that simple, because the number of deaths was higher under Biden, and if it had been in the first year of the Biden administration, and if the problem were that easy to fix, then I think Biden would have been able to step into office and fix it. And so that's why part of the argument in our book is that these were a lot of underlying problems in our country that COVID brought out. That said, the chaos inside the Trump administration, the fact that people didn't trust each other, to the fact that people were more interested in scoring negative headlines against each other and undermining each other's efforts, which almost did in warp speed before it even got started. It's a great story about that from our book. And Trump's own unwillingness to be a leader were definitely problems. I mean, Trump wanted to have it both ways. He wanted to get up in front of people and poo-poo COVID and not wear a mask, and at the same time, he had Deborah Birx and Anthony Fauci running the response. Well, be who you are. Don't be a hypocrite. Either put people in charge and back them up and let them do what you think they should do, or don't have those people in charge and have people who want the economy open and schools open in charge. But he tried to have it both ways. And to me, that's a failure of leadership.
One of the quotes that really stood out to me is talking about H1N1, and it said, "We didn't dodge a bullet, nature shot us with a BB gun."
Right.
So maybe we could have felt that and responded differently. Yeah. John, your pieces especially that I went back and reread early from COVID, you were very responsive to the fact that this This was something that you had seen at least and had discussions about well before COVID came.
Well, I mean, I was involved a little bit in, used to talk to the White House practically on a daily basis in 2009 on the H1, and many of the people who were in, both in the Bush administration and the Obama administration, they were actually pretty much the same people working on that response. It's just, you know, so hard to, I'm actually almost getting emotional thinking about people I know who died, who didn't have to die. You know, let me just stop for a second, okay? I had some very close friends. You know, why don't you go to Bethany?
No problem, Jim.
I'm sorry.
No, it's okay. There were real human costs. Like, we all know this, but like, it's important to feel that while we read this and learn this. Bethany, one that I want to bring to light is that 87% of nurses were afraid of going to work, 36% of them had no PPE, 90% were considering leaving their profession in the next year, of course, right? And yet, the 60 biggest hospital companies got over $15 billion, while 36 of them laid off or furloughed employees. What's happening there?
Yeah, it's pretty stunning. I think just as our supply chains have been stretched to the breaking point, workers in some of our more vulnerable industries have been stretched to the breaking point too, including nurses and teachers. And nurses already felt besieged before the pandemic even hit. And then this happens, and they're being asked to work in unsafe conditions. And it's heartbreaking. And as a result, we as a nation are facing a crisis because of the shortage of nurses that has ensued. And the government is good at bailing out the rich, but doesn't know how to bail out the poor and the less well off. And we saw that in the first time around in the financial crisis, where the banks got bailed out and the big banks got even bigger, and homeowners got very little through ill-thought-out programs that didn't work that well. And this was a better version of that, in that the government did try to get money to small businesses and did try to get money to individuals. I think they realized the societal damage that was done by the financial crisis and tried to handle this differently. But nonetheless, we don't have mechanisms in this country for doing that well. And so the ways in which some of the programs were done just once again benefited the initial hospital rescues, which, going back to what I said in the beginning, isn't it a great irony that in a time where our hospitals were overburdened taking care of people, they were also going bankrupt? And doesn't that tell you that something was wrong with our model, that hospitals aren't paid for taking care of people, much less for keeping people well? But the first round of hospital bailouts were based on revenues. So the wealthier the hospital was, the more money it got from the government, instead of being based on which hospital had the most COVID patients, which hospitals really needed money, where were people overwhelmed. And because of the pressure to generate profits, which, to be clear, I'm not completely opposed to capitalism. I think I am opposed to it in many aspects of our healthcare system. The hospital chains were still under pressure to generate quarterly earnings and to furlough people and lay off doctors and lay off nurses and continue just-in-time staffing, because the mandates from the markets were more important than the human lives.
Okay, and let me get back to your 2009 question for a second. You know, it was a BB gun, but they didn't know it was going to be a BB gun when it started. In 1918, there was a first wave that was extraordinarily mild. The virus changed, and you had a very lethal wave several months later. The people had been preparing since, 2005, really, for a pandemic. Bush took it very seriously, made it a very high priority. They passed a $7 billion bill, including biodefense, general preparedness. But the people who were in the Bush administration, as I said a moment ago, many of them continued to serve in the National Security Council in the Obama administration. They had worked together, they had planned together, they had gone through pandemic war games together. There was trust. They could pick up the phone. They didn't have the interagency rivalries. So that response actually turned out not to be necessary, but they were ready to roll. And none of that applied when the pandemic hit 4 years ago. So there, again, it always comes down to people and always comes down to execution. The 2009 team was ready to execute, turned out not to be necessary. 2020 just was not the case.
And so Bethany, you make a really compelling, but I know probably controversial point about following the science, which turns out to be more treacherous than advantageous in terms of as we learned more, the science changed, and yet some of the policies and declarations did not in the same way. In particular, thinking about masking for children is one example. Also, just the amount of distance for social distancing and other things that you talk about. And this takes nuance, and so I ask everyone to sort of sit with this and take any of your preconceptions, let them strip away, and just listen, because there's a lot to be learned here. Would you mind, with nuance, help us to understand what would following the science really have meant, and what do we get wrong?
So I think that following the science is a dangerous saying, because it implies that science is a set of facts that are known. And science isn't that. Science is a method for asking questions. It's a method of formulating a thesis and then testing what happens in the real world against that thesis and saying, oh, this thesis was right or this thesis was wrong. And we were pretty unwilling to do that in COVID, I think, because approaches to the pandemic really quickly hardened into ideology. And I still struggle to understand why that was. We don't think of arguments about how you should treat cancer or how you should treat Alzheimer's as marking you as a Democrat or a Republican. And yet very quickly in COVID, whether you believed in lockdowns, whether you believed kids should be in school or out of school, became a marker of what your politics were. I was pretty vocal early on about saying that I thought children needed to be back in school, and a close friend's husband called me and said, I didn't know you were a Trump voter. And I said, what does one thing have to do with the other? It completely confused me that your political ideology should have anything to do with what you thought made the most sense. Even today, I get accused, because the book does come out against lockdowns, even today I get accused of being a secret right-wing something or another. And I think, listen to the rest of what I say. How can you possibly think that? I guess that's a starting point. And maybe we can go to John and then come back.
Okay.
Yeah, let's go back.
I think it really came down to communications. When I was in all those early meetings in 2004, 5, 6, 7, the message that I always said, tell the truth, that was incorporated into all the states have pandemic plans. Then the federal government had a pandemic plan. And that was top of the list, that you tell the truth. The problem is that, and in fact, I was talking to Carville about this earlier today, and we agreed. The thing is, you come out at the beginning, you say, this is a novel virus. We don't know what it is. We are giving you the best information we have right now. That information is very likely to change when we learn more. So you can change what you say if you set expectations properly. That was not done, and it was a huge error. In terms of things like schools, I was actually in 2020 opposed to closing schools based on some data from 1889 and from 1918 that probably I was the only person in the world who knew about. And obviously kids weren't getting sick. But I want you to understand why people made the decision to close schools. I'll give you one. But first, kids are vectors. They make other people sick. There's a study that shows if you vaccinate children against bacterial pneumonia, that cuts the disease in people over 50 whom they come in contact with by 80%. It cuts the disease, bacterial pneumonia in people over 65 by 92%. So if you're familiar with facts like that and how lethal a kid can be as a vector spreading the disease, that changes your view about things like closing schools. And as I said, I did know that in 2020. Even so, I wasn't so sure, but because of data that I knew, that, again, I may have been just about the only person in the world who knew the 1889 pandemic at that time, which is hypothesized now not to have been influenza, but may have been a coronavirus. In terms of the lockdowns, yeah, they work, but they're not sustainable. Anybody who says that masks don't work, you're just flat wrong. Yes, they work. Do they work on a population basis if somebody's wearing it below their nose?
Yeah.
If somebody's really resistant to it? No, then they're not going to work, but they will protect an individual. Will the lockdowns work? Well, China proved that lockdowns work. Australia proved that lockdowns work, and so forth, and they turned out to have been very effective. Are they sustainable? Are they worth the price that you pay for them? Those are all different questions. There was, in terms of before the lockdowns were implemented, there were a couple of studies, or actually right after they were implemented, there were a couple of studies of states, communities bordering on one state that did lock down and one state that didn't lock down. And the economic impact in both those areas in the border area, it was practically identical. Because people were staying home not necessarily because of government orders, but because they were afraid of getting sick and dying. Now that did change over time when people realized, the elderly were so incredibly vulnerable, but so were people with comorbidities, including obesity.
So a place where we agree, and then I'll disagree a little bit, but a place where we agree is, I think one big lesson from COVID is that government and all leaders have to get better at saying we don't know. And it's a really scary thing for a leader to say because they think we're all dumb and they think that we need to be given really super simplistic black and white answers or we won't possibly be able to follow any guidance. But the problem in a world awash in information is that if you tell people something and you're wrong, they're going to figure it out. And so you can't do that anymore. You have to give people credit for being smart and for doing their own work because the risk of not doing that is that they don't trust you anymore. So we're in a new world, and I think leaders of everywhere have to realize that the power of saying this is what we think and we're doing the best we can, but we're not sure, instead of risking a black and white statement that turns out to be incorrect. I have a somewhat different take on school closures because I worry a lot about teachers, and COVID was so terribly unfair because kids weren't affected. Teachers could have gotten it from kids and been affected. How do you manage that? At the same time, the school closures were terribly unfair to the portion of the population that we all say we care the most about and which we all should be the most invested in protecting, namely economically disadvantaged children. And that's the population that has been crushed by school closures, and they can never, ever get that back. And I think we're going to be dealing with the costs of that as a country for a really long time. You still see it in sky-high absenteeism rates in particularly affected districts. And I do believe deeply that if white, wealthy people had not been able to send their children to school, to their private schools, or to have a parent at home to help with homeschooling during the pandemic, schools would have been opened a lot faster. And you don't have to look further than California, where Governor Gavin Newsom kept the public schools closed while sending his own children to private school. If he had not had that option, I bet there would have been a different approach. And I feel that way broadly about lockdowns as well. If it hadn't been for Zoom that enabled well-off people to keep their incomes and work from home and have a nice, convenient life while essential workers delivered their Amazon goods and their food, we would have had a different approach to this. If I had lost my job and not been able to make an income and not been able to support my kids, I would have felt differently about lockdowns than I did. But I do think the real question about this is exactly what you said, John. What's sustainable? What will a population do? And my co-author wrote this portion of the book, but he wrote about a scientist named D.A. Henderson who was
He's a friend of mine.
who was instrumental in stamping out polio, and he basically said the smallpox. I'm so sorry. The best approach to a pandemic is the one that is most sustainable, that is sustainable by a population. And yeah, if an infectious disease is sweeping the country and you can put everybody in their own locked box and keep them there forever, guess what? The disease isn't going to spread. But what are all the collateral damages of that? And so Francis Collins, the head of the NIH, I think during the pandemic, said something which is that public health has a really narrow view of the world. They're going to do what is going to save people's lives. They're not going to look at the collateral damage that is happening. And that was the job of a leader, to look at the collateral damage that was happening as well. And I think we lacked that form of leadership.
I'm going to ask one more question, then ask if you wouldn't mind lining up for either of the mics to ask questions during the next 10 minutes. This has been a rosy conversation. I'll end a little bit more of a hopeful note, which is Operation Warp Speed really worked. And it was really inspiring to read in both of your books just the fact that we were able to do that, even though we weren't able to do so much else, as we've discussed. Why did it work, and what can we learn from it? John?
Well, you got good people, and you gave them resources. They knew what they were doing, and you let them alone. There was no interference from the White House. And you have to give Trump some credit for that, because he could have said no when they went to him with the idea. It's pretty much that simple. We need, there are actually, the federal government builds some very sophisticated vaccine manufacturing facilities, one at Texas A&M, one near Baltimore. These are brand new facilities. I remember touring it under construction in, I don't know, maybe 8 years ago. Never used. Not a single dose of vaccine came out of, certainly hundreds of millions, maybe $1 billion investment in those things. But the private sector did come in, and so did Pfizer, where Pfizer ended up getting some help in terms of resources, but they wanted to do it completely on their own.
So I think one of the fundamental lessons from Warp Speed, which is really encouraging to me, is that government and business can work together. Capitalism works when government sets the right rules for it to succeed. And the story of Warp Speed is really Alex Azar, who is the head of Health and Human Services, realizing that the private market on its own was never going to produce vaccines. Vaccine manufacturers had been burned in the past by pouring hundreds of millions of dollars into producing a vaccine only to be told, oops, no pandemic, we don't need you, and their shareholders punished them. And the US lacked the manufacturing capacity in order to build vaccines at speed. And so Warp Speed was really an effort to do two things: to supply a guaranteed market so that companies had the incentive to develop the vaccines. And it was an industrial manufacturing story of really close cooperation between the private sector and the Army in order to get manufacturing capacity in the United States, so that we didn't just get the vaccines approved, we got them manufactured. And I think capitalism works when government sets the right rules for it. And so this is inspiring to me. But it's also, to your comments about the Trump administration, the guy who ran Operation Warp Speed, the scientific lead, was a guy named Moncef Slaoui. And I think he'd forgive me for saying that he's basically a socialist. No fan of the Trump administration whatsoever. But when he was asked to do this, he put aside his politics and stepped in to run Warp Speed at great cost to himself also. He knew that Moderna was going to be a success story. He had been on the board, and he sold all his stock to step in and take over this pretty thankless task. And I think would be a stronger country if more of us could put our ideologies aside and do what's right for the nation in a moment of crisis. And so I think it's a really inspiring story on that note.
you know, what broke down after that was the distribution of the
Yes.
vaccines.
Yeah.
They don't work if you don't get them into people's arms. But, you know, we have
Fair
somebody
enough,
waiting
yeah.
for a
I was
question.
trying to give us some hope, John. Yes, sir. We'll go over here first.
Yeah, thanks for a great presentation. Read your previous book on influenza. I'm a physician. I'm an infectious disease physician. I'll just start off in 2000. I was at the CDC when we did H1N1 war games, and at the end of that war games, everybody came out and said, "We're unprepared." But what happened in the succeeding years was we became very prepared. Now, in 2018, the CDC leadership changed, and in my opinion, they were totally incompetent. These people were not qualified to be in those positions, and those were the people that we saw on television. Now, the people that were there in 2000 would have fallen on their swords at the misinformation given at the highest levels. So I think that is a major factor of really what happened going on. Also, I want to say health is a human right. Okay, I've worked in England and Switzerland. These systems work very, very well, even though they're trying to be destroyed, especially in England. We need that in this country. Okay. Lastly, I'll just say from my clinical experience, treating COVID patients, I never went on lockdown. Okay, I would walk around with a mask everywhere. So I did everything that I had to do. I was working as a physician. Treating some of these patients was terrifying in the beginning. We had a patient 52 years old, ran half marathons, had no comorbidities, died. Okay, the youngest patient I had died 27 years old. We still don't know why some people manifest this disease worse than others. So it's a little like polio. You give 100 people this disease, mostly children, and one becomes paralyzed, and the other dies. So there's so many questions
Unanswered.
about this, and the last thing I'll say really is,
And do you have a question for?
no, I don't. I just wanted to give I just wanted to say I'm really looking forward to reading your book. Oh, the last thing I would say is Laurie Garrett wrote an article on January the 31st. You know who Laurie Garrett is, saying that this epidemic is coming to the country. And nobody seemed to pick up on that or do anything at the
I wrote
highest
it on
levels.
January 14th.
There we go.
Then you beat her, yes. So it was really, really discouraging from a clinical level. The last thing I'll say is about the CDC is, unfortunately, the CDC, everything's done by the states, as you mentioned.
We are running short on time, sir.
Yeah,
I'm
go
sorry.
ahead.
Thank you. Next question, please.
One lingering question is the genesis of COVID. And so two-part question, what's kind of the latest that you're aware of in terms of the reporting on that? And how important do you think it is from sort of a biological, a cultural, a psychological level of really knowing where it started?
For us, it took 14 years to find out the source of SARS-1. So it's not that amazing that we don't know the original animal for this at this point. Second, you know, I was a co-author. We 34 people. We had different opinions. We ended up saying that both hypotheses are plausible. I know a guy I have high respect for was convinced it's China. You know, I think all the evidence, not coincidence, but all the actual evidence says natural. I know people who are on, one of them, Robert Gary, is a very good scientist at Tulane, who's on one of these controversial calls with Tony Fauci early. You know, I know these people. They're not liars. You know, they didn't manipulate the information to change things. You know, they are pretty much, I know Gary is, and I think the evidence is pretty overwhelming, maybe not overwhelming, very strong, that it was natural. It's not completely compelling. It could have happened the other way. I don't think in the sense of what happens next, it matters, because it could happen, and we need much greater safety standards and controls for future experiments. In terms of diplomacy and international relations, yeah, I think it matters a big deal. But in terms of future health policy, it shouldn't matter at all.
I do want to make sure you get one more question in. Yes, ma'am.
Thank you, and thank you both so much. I read your book. I'm a physician. I read your book at the beginning of the pandemic, and it was terrifying, but great. My question, speaking of distrust, that continuing decline in vaccination rates in some parts of our country, thoughts on the public health outcomes that are additional fallout from this pandemic?
Well, I mean, you pointed that out. And probably in this audience, you all know that counties that voted for Trump had higher mortality rates than counties that voted for Biden. There was a partisan divide, and the later you got in the pandemic, the bigger that divide. It wasn't all vaccination rates. In fact, the vaccination rates for the elderly, who are obviously most vulnerable, is very, very similar no matter what county you're in. It was more tuned to behavior. But we are seeing, now there's threats about measles coming out in various spots around the world, and that is a serious long-term threat.
For all the optimism of warp speed, I do think that some of the resistance to vaccination is also a failure of public health and a failure of public health messaging. Because I think if public health officials, when the vaccines had first been approved, had said, these are amazing, it looks like they prevent most hospitalization and death, we don't know what they do in terms of transmission. And yeah, you might still get COVID if you get vaccinated. I think some of the vaccine skepticism would be less. Instead, when there was an outbreak in Provincetown, Rhode Island, and people who were vaccinated got COVID, and it turned out that people who were vaccinated still transmitted. It became this huge negative thing. The vaccines don't work, and that's because they were oversold. And so I think it goes back to one of the comments we both made about the importance of telling the truth and saying, here's what we know and here's what we don't know, and being very clear about that.
Well, thank you both for being truth tellers. Round of applause.